again, Dr. Bruce McNab, PhD, One Health Epidemiologist with Novometrics Research Inc., working with a group of people on communications for COVID-19. Now, a concept that we need every man, woman, and child on the globe to understand, to internalize and know in their heart to be true, not because some so-called expert told you, but because it just makes sense. It's just the only way things can be. So one of those concepts is that viruses only obey laws of biology. They do not obey, they do not recognize, they don't know about our societal laws. They have no respect whatsoever for our constitutional right to assemble, to choose what we wear, to go where we want to go. They don't care, okay? So we have to address the laws of biology if we want to manage COVID in a reasonable way. So what does that mean? First, you have to realize that viruses do not have legs. They do not move about on their own. They only move where we as people pick them up and carry them and then deposit them. So when we touch something that's contaminated and carry it, or carry something that's contaminated and move it, or inhale the virus from the air, or when someone sneezes on us, or when we touch our eyes after we've touched something that's contaminated, we then, you and I, then personally carry it and deposit it somewhere else. And because one can have the virus and shed the virus when they don't even have symptoms or extremely mild symptoms, that means we have to be careful to minimize the amount of spread we cause, and we're the only ones who can spread it, by staying home and self-isolating when we show any signs of illness, or when we know we've been exposed to someone that might have had it or probably had it, maybe they tested positive, or when we tested positive. We really cannot be out and about when we know, or there's a high probability of it, that we are personally shedding it. And when you do go out and about, you need to minimize the number of contacts you make. I'm not saying that's fun. I don't like distancing. I don't like reducing the number of times I go out. I hate it. But I also know it's the only way we can address the biology. And you have to reduce the probability of transmission to another person or receiving it from another person when you are out and about and contacting people through things like physical distancing as best you can in the situation you're in, and things like wearing a mask when you're reasonable to predict you will be unable to distance, so you need to wear a mask. Things like washing your hands frequently because you may have touched something that's been contaminated. Those are the only tools we have to prevent spread, and only you and I can do that personally. Your doctor can't wear a mask on your behalf for you. Your politician can't distance for you. The Chinese Communist Party can't wash your hands for you if you're trying to blame them. And even your Aunt Matilda can't do this for you. Only you can do those things. That's why it's extremely important that you do the best you can in all of the above in your personal situation. Now, for me, being retired, it's pretty easy for me to stay at home a lot. For others who have to go out to work, you need to do the best you can in your personal situation. Another concept that's really important to internalize and know to be true is the concept that spread of disease, infectious contagious disease like COVID, is inherently exponential. And you've probably heard many times that, if a person is infected and transmits the virus, sneezes on somebody, or breathes out the virus in a confined room, and such that 2 other people become infected from that first person. And then if each of those people go on to infect 2 more people, we get 4 people infected in the next round. And then if each of those go on to infect 2 more people, we get 8 people in the next round. So that's expanding exponentially. So that's pretty easy to understand, that starting from 1 person and seeing it go out to 8 and 16 and 32 people. But you also have to understand, if instead of having one person infected that's spreading it exponentially, what happens when you have, 500,000 people currently infected and spreading it? Such as currently, this is being recorded July 10th, 2020, in the United States of America. We would have, I suspect, at least 1 million people actively shedding the virus today, causing exponential spread. And when one doubles the number of people infected, as happens in a very short time in exponential spread, it's one thing to double from 50 to 100 to 200. The health system can handle that, okay? But when you talk about doubling from 1 million people infected to 2 million people infected to 4 million people actively infected, that's a problem, okay? Even if the percentage that end up in intensive care is relatively small, and if the mortality rate among those infected is even smaller, that's still a very, very big problem. You've looked at the news in the state of Florida recently. It took 6 months to get up to about 10,000 new cases per day, and then only a few weeks to get up to double that, to get up to 20,000 new cases a day. Now those new cases, that's on that day, people that tested positive. Now yeah, maybe some of those were being tested for a second time, so they're being counted twice. But the most of them wouldn't be like that. And even so, the trend is growing exponentially. And those cases don't go away tomorrow. The 20,000 you found today will be still infected and shedding, most of them tomorrow, and probably shed on an average of, say 5 days to a week, something like that. So that's, even at 5 days, getting 20,000 new cases a day, that's 100,000 people actively shedding the virus at any one time. That's exponential growth from 100,000 people in one state, okay? That's a problem, okay? So we cannot let it get up to those levels. We have to reverse the trend, get the curve down, as they say, and keep it down to a manageable level. Not zero. Pretty sure we're going to get a vaccine sometime in the not too distant future, but we can't let it get up to levels where doubling is from like 1 million to 2 million to 4 million. That's a problem, okay? And so even in countries that do have it under control now, they can still screw it up if they ease up and don't watch things very closely. Now, I'm not talking about shutting down the economy completely. It's just that because the bug has no respect for the economy, we have to continue to address the biology as best we can, and that's easier when you have the numbers under control. So those are two concepts. We must address the laws of biology, and we have to be really careful because it's exponential growth that every person on the planet needs to internalize and know to be true in their heart, not because some expert told them, but because it just has to be true, and realize that they are the only people who can affect change through their personal behavior. By choosing not to behave appropriately or not to address the biology, say by refusing to wear a mask when you're in confined areas, you can do exponential harm. You can cause a lot of people to get sick through exponential spread from you, okay? Whereas if you choose to wear a mask, not because somebody ordered you to or whatever, because you should, because it's the right thing to do, because it will help to reduce the probability of you becoming infected and you from infecting members of your family and you from infecting members in your community and you from causing exponential harm. In a sense, you can be an exponential superhero by preventing an exponential number of cases through your personal behavior. And until we get a vaccine, yours and my personal behavior around the globe for every citizen is the only tools we have to manage COVID-19. So please do the best you can to implement those practices within your personal situation. Thank you.